Hello everybody. So in this module we'll be looking at and discussing about the various instruments which are being used for posterior cervical spine instrumentation. Posterior cervical spine surgeries are not very common surgeries, and the commonest etiology for which posterior cervical spine surgeries are being performed is cervical myelopathy, especially multi-level cervical myelopathy. So the implants or instruments which we use is cervical lateral mass screws. In thoracolumbar region we saw something called as pedicle screws, but here we use something called as lateral mass screws. Because the lateral mass screws are relatively safer compared to the pedicle screws in the cervical spine. Because in cervical spine, if the pedicle screw goes medially, it will hit the spinal cord and it can result in profound neurological deficit, whereas if it goes slightly laterally, it can hit the vertebral artery again, and if it is a dominant vertebral artery, it can result in stroke and a major neurological deficit. Because of the various complications related to cervical spine pedicle screws, though it is a biomechanically superior construct compared to lateral mass screws, we commonly use lateral mass screws for cervical spine. Having said that, I have been using cervical pedicle screws for the past 7 years, and I am not using lateral mass screws for the past many years, because I feel cervical pedicle screws are biomechanically much more superior and stronger than lateral mass screws. And if you have been trained and if you have reached the learning curve of how to use a cervical spine pedicle screws, it is always better to use a cervical spine pedicle screw. Now let us get on to the instrumentation system. The first and foremost instrument that we are going to see is the awl. It is otherwise called as a starter, but this is commonly called as awl, and it is used to make an entry point for the screw in the lateral mass. We'll just see about how to put a lateral mass screw in a sawbone model, but before that we have to be familiar with the instruments that is being used. This is similar to the awl which we saw in the thoracolumbar pedicle screw system. So once you make an entry or a starting point, the next instrument, either you can use a thin probe designed for cervical spine, or you can use this drill. Okay, so this is called as the drill, and you have a sleeve for the drill. The main advantage of this sleeve is you can see the markings here. Okay, so these markings are very, very important. For a lateral mass screw, usually we use 16 to 18 mm. So you have to keep this, push this and adjust the markings, and you have to place it over 18 mm, and then if you insert the drill, you can see this will not pass beyond that, because you should not go very much anteriorly and hit the vital structures. So you can use this. So that is the purpose of this sleeve and the drill. So in lateral mass we usually do not use probes, because it can damage the lateral mass as such, because it is predominantly made of cancellous bone. So it is better to use a drill. Once you have used a drill, either you can go in with the insertion of the screw directly, or you can use something called as the tap. Just like in the thoracolumbar pedicle screw system, you can use a tap. This is a 3.5 mm tap which can be used for 3.5 mm screw or a 4 mm lateral mass screw in the cervical spine. So once that is done, you use a polyaxial screw just like this. So this is the polyaxial screw, just like in the thoracic or the lumbar spine, but you can see the length of the screw, it is just about 14-16, or if you are going to use a pedicle screw, you will get a good length. You can go about 26, 28 or even 30 mm screws can be used, but however the diameter is usually 3.5 or 4 mm screws. So this is a self tapping, it is not a self drilling screw, but it's a self tapping screw, and you can use it. But however, it is always better to use a drill instead of a probe, and in case of cut out, or if you are using a new fresh starting point, it is better to use a tap always before inserting the screw. So this is how the screw is loaded in the screwdriver. Okay, so this is the screwdriver. As you can see, this can be detached like this, and you actually pull it up, place it inside, lock it, check it before inserting. And again, these mechanisms we discussed: forward, reverse and ratchet. So these clicks are for that, and then you place the screw, lateral mass screw, and then you gradually insert. I personally do not use ratchet for cervical spine because I want total control of the screw when it is going inside. So I always use the forward turn instead of a ratchet for cervical spine, lateral mass or pedicle screws.